Hi guys, this is Dr. Sparsh Gupta. Being a professor at a eminent place in a national medical college and as an invited examiner to different universities across India, there are certain tips that I wanted to share with you, certain do's and don'ts that I wanted you to keep in mind as and when you are appearing for a professional exam, particularly the practical examination. The first aspect of your appearance in a practical exam is your physical appearance. So here I'm talking about the non-academic part of it. For example, if you're lucky enough to be in a medical school and still having hair on your head, please make sure that your hair is not going to be in sync with the current fashion. I have personally no objections to people having whatever kind of hairstyle that they may be carrying, but having an interaction with majority of the senior examiners, I personally find examiners would like the hair to be properly cut. In case you are keeping a beard, make sure that it is trimmed and at least it is going to be properly done. In case of females, your hair have to be properly tied up. We understand a lot of us would be really happy to have those wonderful stylish side cuts. We could be happy having a goatee or a Frenchie or for that matter gelling our hair as well. But those are the things I personally want you to reserve only post examination celebrations. Fact number 2, whenever we are going to be talking about the footwear of a student, you are not coming for a casual appearance. You are not allowed to be coming either in your slippers, you are not allowed to be appearing in your sport shoes. Make sure that you are having a decent pair of formal shoes which have to be taken care of in the sense that they have to be properly polished, and that is going to be gelling in your complete appearance from a formal assessment in the examination. The third thing I wanted you to be familiar with is that avoid wearing any kind of an attractive or a shiny or for that matter at times even the torn clothes. We are not going to be assessing you based upon what kind of a brand of the clothing that you are wearing, but it is very pertinent that the clothes that you are wearing, they have to be clean. My personal observation across the country has been in a batch of say 100 students, there is a small bunch of 10 to 15 students who are going to be having a shabby lab coat as and when they are facing me in a Viva. The other thing, students are so casual at times that they may be wearing an overall which may be containing their name. Please understand, as per majority of the university guidelines, you are not allowed to disclose your identity to an examiner. Very ironically, the lab coat that the individuals are wearing, the students are wearing at times is a borrowed lab coat. That means it is from a friend. So what we have to ensure is that we have to wear a lab coat as and when you are appearing in any kind of a practical, be it anatomy, be it pharmacology, be it pathology, be it biochemistry, be it microbiology, be it a clinical practical examination, which has to be clean. It has to be proper in the sense that it should be fitting your size. See, the purpose of wearing a lab coat is that it is going to be not only giving you an impression of you being a med school student, but it also is going to be one of the key equipments which is going to be serving as a protective gear. So make sure that your lab coat is going to be having both the functions. Talking about the academic aspect of it now, whenever you're going to be having a Viva, my humble request to you is be absolutely polite and gentle in your Vivas. It's always a good habit to go and wish your examiners. Try not to enter into an argument with your examiners. I'm not telling you that your examiner is going to be telling you that the sun is going to be rising from the west and you have to agree to it. All I'm trying to tell you is try to diffuse a situation of crisis if unfortunately it so happens. For example, if there is going to be a difference in opinion between what you think as an answer to a question and what the examiner is going to be giving you as a hint, or if the examiner is not very pleased to hear your answer, you can obviously either defend yourself based upon the facts or at least display an attitude of some kind of politeness. You don't have to be either getting too aggressive about it. Couple of rare instances where people have actually left the Viva Voce room, they have gone back, they have opened the books, come back to the examiner, showed them, so this is what the latest guidelines are telling us and therefore what I am telling is correct. So academically brilliant people who are going to be having a very good theoretical knowledge of the subject have flunked in the examination just because of their poor attitude. Avoid that kind of a conflict with the examiners. The other important thing is in an exam, it may so happen, and that is very rightly so. I have been a student myself, so when I go and assess a student, I understand the problems being faced by a student. It's a high pressure, it's a high tension situation. There is a fair chance that the student may be having a mental block as well. However, if the examiner starts asking you questions, and let's say after 3 questions you do not know the answer to the question, and just by chance he or she asks you, have you actually read this particular subject? You should not be blunt enough to say that I haven't read the subject, I was awake the whole night, I am not able to recall anything. You see, that doesn't help you. Our purpose of making a med school graduate is that ultimately the med school graduate, he or she has to save a life. So any examiner, no matter howsoever close he or she may be, whether he is an internal or he is an external, is not going to be giving you a clearance if you are not going to be speaking up something in the Viva. All that the examiner can do perhaps for you is that they can actually ask you certain informal questions so that your mental stress reduces a bit. Then they may be asking you certain easier questions so that you recall at least some part of the subject which is being asked for. And then he can probe you regarding the assessment of the depth of the knowledge that you may be having. So what I'm trying to tell you is, please do not create a bad or a negative impression on the examiners by saying that you haven't read a particular subject at all. This kind of a bad impression is going to be really having an influence when your final assessment is being done by a particular examiner. The other important thing is, from a particular topic, I can talk about, let's say, a topic like hematology, or I'm talking about a topic like, let's say, respiratory system, or if I have to talk about cardiovascular system in pathology, and the same may be holding true for pharmacology as well, or if I'm talking about microbiology, maybe some bacteria, some virus, some fungi, some parasite, some worm. Make sure that from each of these units, there has to be at least one topic that you have prepared really well. Why do I say so is, there have been examiners who have been kind enough to ask students whether there is any one particular favorite topic of theirs or any particular strong topic of theirs from which the examiner can be free enough to ask you questions. In case you get such an opportunity in any of your examination, please don't miss it. Ensure the fact that you are able to talk about a topic which is very thorough with you, so that any kind of a question that the examiner throws at you in the next few minutes is tackled very aptly by yourself. Other important thing that I have observed with regards to students is, suppose they get stuck up in the Viva Voce. You see, no examiner intends to flunk you unless and until you perform really bad, or unless and until you are going to be absolutely below par. So examiners at times are going to be sympathizing with you, they empathize with you, and they might be giving you certain hints. Be smart enough, be intelligent enough to pick up those kind of hints, so that these hints can be helping you remember certain facts or recalling certain facts and then progressing in your Viva Voce. Another important fact that I want you to be familiar with is, do not try to play guess games with the examiner. It has happened so many times that out of our anxiety, out of our fear, for example, somebody is appearing in a anatomy Viva and the examiner happens to ask you the kind of textbook that you have read. You may have never ever seen a book like Gray's maybe, or for that matter Snell's, or for that matter Keith Moore. You may have read a decent enough book like, let's say, B.D. Chaurasia. But then just to impress the examiner, you take the name of a book that you haven't read. You see, examiners have been through this kind of a stage. We as examiners have been assessing students for the past so many years. So do not try to befool an examiner, because you are actually not trying to befool an examiner, you are befooling yourself. Be honest enough to admit the learning resource material that you may have used, and try to recall the important and the relevant points which have been asked by the examiner from a particular question. So those were the examples of the non-academic and the academic tips that I wanted to share with you. Obviously, I would like to include over here that these are not any kind of guidelines which have been given by any of the medical commissions or any of the governing bodies, nor I'm trying to say that these are the only criteria which are going to be used by all examiners across India. But this has been a personal observation, and I thought that if I could be sharing some of my thoughts with you, there is a good enough possibility that some of the blunders that a lot of people do are, in the habit of performing, these blunders are being avoided by us, so that we have a cordial and a congenial environment where our assessment is being done, and subsequently, as and when the results are being declared, then we are going to be having a smile on our faces. I'm going to be sharing with you more videos in due course of time pertaining to how should you be doing well in your professional exams. So do stay tuned to the channel, do subscribe to the channel, and my very best wishes for a great performance in the examinations. Thank you so much.